Welcome to Medication Monday. This is where we go over a different EMT drug that we administer out in the field. We do it specifically in EMT drug card format. As always, follow your local protocol and scope of practice. Enjoy. Today's medication is called ketamine, and ketamine has several brand names, but one of the most common is Ketelar. It falls under a few classes: analgesics, anesthetics, and sedatives. So the mechanism of action of ketamine is that it antagonizes the MDA receptors that process the input of our central nervous system. Ketamine goes in and blocks the sensory input, and this produces the dissociative analgesia and sedation. So your indications for ketamine, or when we would use it, is moderate to severe pain if our narcotics are not managing the pain, excited delirium, and sedation. As always, before I get into dosages, please abide by your local protocol and always stay within your scope of practice. Your dose for pain is going to be 0.1 milligrams per kilogram, slow IV push or IO push every 3 to 5 minutes as needed. Sedation will be 2 milligrams per kilogram, slow IV push or IO push, but if you're going to give it intramuscularly, it'll be 5 milligrams per kilogram. Contraindications will be severe hypertension and known hypersensitivity to the drug. Adverse reactions can be hypertension, dysrhythmias, tachycardia, respiratory depression, CNS depression, decreased mental status, nausea, vomiting, and emergence reactions. As we know, ketamine does work on our central nervous system, so it can and will interact with narcotics, other benzos, sedatives, and hypnotics by increasing the already present central nervous system depression. It's supplied in several different concentrations. There's 500 milligrams in 10 milliliters, 200 milligrams in 20 milliliters, 100 milligrams in 1 milliliter, or 50 milligrams in 1 milliliter. A few side notes about ketamine. The onset is usually less than 1 minute, but the duration is typically between 10 to 20 minutes. And if you don't already know, ketamine is a paramedic level medication in most states, but in some states it's still strictly a special skill, which just basically means that your department or service would have to apply to the state EMS department and get it approved by your state medical director in order for you to actually administer this medication. I know I mentioned emergence reactions in your adverse effects, but if you've never heard of that, this can actually occur with large doses of ketamine. This is a type of reaction that can be described as hallucinations or out-of-body experiences by the patient. And that's why they kind of say to start off with the low dosage before you go up, because as we know, we can always give more, but we can't really take away. Ketamine can also be used in rapid sequence induction or intubation. It just depends on your protocol. And always, guys, remember to abide by your local protocol and scope of practice. This is purely informational for those in the EMS field and never meant to be used in the place of medical direction, local protocol, or formal education. Thank you guys so much for watching, and I'll see you next Monday.